when a patient presents to our clinic with a myeloproliferative neoplasm, we really try to do a comprehensive assessment. Certainly we start with our physical exam and really looking for everything from muscle wasting to splenomegaly to really erythromelalgia. We look certainly at the blood counts in particular with close scrutiny to the peripheral smear. And then we have patients fill out a questionnaire regarding their symptoms with their MPN, in the waiting room before they visit with us. So we use the MPN 10 items that give us a good sense of where their disease stands in terms of their symptoms, and then we try to triangulate all these aspects to see where they stand with their disease. Well, an inadequately controlled PV patient might have many different components, or let's say different phenotypes that they might have. It's ongoing phlebotomy need well into therapy, where they really should have already exhausted that need. It's uncontrolled leukocytosis. It's difficult to manage symptoms. It's really failure of current therapy with hydroxyurea because they're intolerant, mouth ulcers, leg ulcers, they have neutropenia, or they're resistant. They're on a full dose of cytoreductive therapy and really their counts aren't controlled, their spleen is enlarged, they have too many symptoms. Any one of those can really be a sign of inadequately controlled disease, or clearly if people have all of them, it's really quite poorly controlled. One, it's a common question when patients have PV. They ask, are there things that I should avoid or things that I should be doing? In terms of things that they should avoid, I try to take some of the stress away from them, and that there's really not a strong contraindication that we know of at the moment for avoiding foods with iron or things of that nature. I do certainly have them avoid iron supplementation. In terms of things that they should be doing is, again, really being active. We know physical activity, being active helps to combat the fatigue, helps certainly in terms of risk of blood clots and other difficulties. Additionally, really education around their disease, in part to try to decrease some of the stress they can have with the disease. I think the better patients are informed about their disease as well as where they stand, that can have a very favorable impact in terms of their stress.